An important thing to understand is that we just don't stick a needle in the tear. You have to understand why the rotator cuff is torn in the first place. If it's a degenerative tear that's occurred over the course of time, we're going to treat the joints, usually with bone marrow aspirate, to help the process of changing the internal environment from one of breaking down to one of rebuilding. And also, we're going to treat the ligaments to stabilize the shoulder. So I wanted to talk about the restrictions following rotator cuff surgery versus the restrictions following a regenerative rotator cuff repair. With surgery, the restrictions are, first, you're going to be in an airplane splint with your arm out at 45 degrees for somewhere between 4 to 8 weeks, at which point you will have no strength in that shoulder. They will allow you to do Codman exercises, but they will not have started you in more aggressive physical therapy. So you'll be able to do pendulum exercises with your shoulder. In the case of a large rotator cuff tear where we're treating the patient with bone marrow aspirate, most typically they're in a sling for a period of 7 days, and they're starting in physical therapy the week following treatment. And again, their restrictions are going to be based upon how they do in physical therapy. Obviously, somebody who's had the bone marrow aspirate treatment is not going to be able to lift anything above their shoulder level, probably for up to about 2 weeks, and maybe 5 to 10 pounds at 4 weeks. But the recovery is going to be much quicker because we're enabling people to go back to therapy much quicker. We're restricting them much less time, and they have had less of an insult to their shoulder with needles rather than scalpels and drills, etc. So that in the case of using platelet-rich plasma for small rotator cuff tears, typically they're going to use a sling for up to 4 days just for comfort measures and get into therapy again within 5 to 7 days of having the injection of a PRP in the shoulder and the rotator cuff. And then their return to function is going to be quicker than if they had bone marrow aspirate. So with orthobiologics, we expect a good recovery at about 3 months. I think that with a large rotator cuff shoulder surgery, you're looking at 6 to 9 months and sometimes even a year after the procedure to try and get back to full function. Our success rate is good. I think that with rotator cuff repair, success rate is also good, though the re-tear rate with rotator cuff repair is up to a third of the time. I think sometimes orthopedic shoulder surgeons forget to take a look at the neck, and the neck can cause a nerve undersupply to these vulnerable muscles, and therefore they're more prone to tearing. We regenerative interventional orthopedic doctors try to look at patients more holistically, understanding that the spine bone is connected to the shoulder bone, and if you don't have a healthy spine, it's going to be a more challenging recovery. So I've treated a lot of people with rotator cuff tears. I've treated people with full thickness tears. I've treated people with large partial thickness tears. But I'm thinking about one person that I treated recently with a large thickness tear. I used bone marrow aspirate and buttressed the tear with adipose tissue, which is fat, to fill in the gap. Her gap was about 2 centimeters, which is almost an inch, and I treated her joints, both the glenohumeral joint and the acromioclavicular joint, with her bone marrow aspirate and treated the ligaments to stabilize the ligaments as well. This was a degenerative tear that had been around for a couple of years. She responded very nicely to this treatment. She gained her full range of motion back. She gained her strength back, and she was able to perform most activities, if not all activities, that she wanted to do without too much difficulty. And she was able to do that 3 months after treatment. She was in a sling for 7 days. So she's an interesting example of somebody who had a large partial thickness tear. Another person had a large full thickness tear greater than 3 centimeters. She was a hairdresser in her 50s, and she wanted to be able to return to work and continue working. And I knew that I couldn't fill in the gap of a 3 centimeter full thickness tear. She didn't want to undergo surgery. She didn't have time to be off work. So I treated her ligaments, stabilized the joint. I treated her both joints, the glenohumeral and acromioclavicular joints, using bone marrow aspirate. Over the course of the next 2 months, she went from pain, which was moderate severity, a 5 out of 10, to a 1 out of 10. She gained some of her range of motion back, despite not having the rotator cuff muscles, because the body learns how to substitute one muscle for another. In this case, it substitutes the deltoid muscle, which is the large muscle on the outside of your arm, for the rotator cuff. So she was very happy. She went back to work, and I haven't seen her other than her formal follow-ups. It's been about 5 years, and she's done well. She has not come back for treatment, and she has not undergone surgery. So this is an important point, because not everybody with a big rotator cuff tear wants to get it repaired, and they can also be helped by treating the rest of the shoulder to maintain stability and mobility.